Today we're here at Erwin Health Care Center, and I am joined by Jason Bennett, the administrator here. And Jason, we're talking about long-term planning and for a long-term stay or short-term stay here at Erwin Health Care Center. When do families need to start thinking about long-term planning for their loved one?
Interestingly enough, a lot of big life decisions, getting married, buying a house, you think about, you plan, buying a car, you research it. Most people don't research a stay in a long-term care facility. Typically, family members confronted with a social worker that walks into the hospital room and says, your mom or dad can't go home. Here's a list of nursing homes. You have to make a decision whether they're going for short-term, 90 days or less, or long-term. And if you haven't done any type of planning or exploring, you're just basically rolling the dice. A lot of people also take advice from friends and coworkers, pastors, when in reality, choosing a nursing home is like buying a car. If you're a Ford person, you want a Ford. If you're not, you want a Chevy. Every facility has some different avenues. So like Erwin Health Care Center, we specialize in those afflicted with dementia and certain behaviors that are disruptive to normal life. And so if your loved one is having some dementia or having some behaviors, they may not fit in at a traditional nursing home. And so rather than move them into one nursing home who then will kick them out after a certain amount of time, and then another nursing home and another nursing home, consistency and long-term placement is best for the health of the elderly.
So how do you prepare financially for long-term care?
Well, there's a bunch of different ways that people can pay, but one of the biggest problems is everybody thinks Medicare pays for long-term care. Medicare actually does not pay for any long-term care. It only pays for what is known as subacute. So that is the short-term Medicare stay. Medicare Part A pays for up to 100 days per spell of illness. The first 20 days are covered at 100% by the federal government. The remaining 80 are covered except for a federally mandated co-insurance. Medicare is short-term. You look at long-term. Long-term comes down to usually private pay money until the individual runs out of funds, and then they have to make Medicaid application.
When it comes to long-term planning, there's basically a chain of command of who makes decisions for the person that is coming into long-term care. Tell us about that.
Okay, well, typically, like if you come into Erwin Healthcare, we will set up a meeting called a care plan, and we'll discuss this with your spouse initially. If you become unable to make your decision, or if you have dementia so that you are not making rational decisions, if you have no identified power of attorney, or you have no conservator in place, we go to your spouse. If your spouse is unavailable and you have no identified power of attorney or conservator, then we would go typically to your children. That is kind of the unwritten direction we go of authority of decision making. I want to say that I am not an attorney, and I'm not giving legal advice, and I'm not a financial planner, so I'm not giving financial advice. But typically what we recommend is before you get to that point where you can't make decisions, that you get a documented power of attorney. And it can be either a power of attorney of healthcare, a power of attorney of finance, or a durable power of attorney overall.
You're an expert in Medicare, Medicaid, and you're certified in both of those areas.
Yeah.
Talk to us about why that certification is important.
In long-term care, there are facilities that are private pay only facilities, and a lot of assisted livings are private pay only facilities. They cannot accept federal funds under the Medicare program. They cannot accept state funds under the Medicaid program because they have not been certified. When you are certified, you are inspected regularly by the state and the federal government to say that you are up to the standards, and those standards change constantly.
How are you going to help, first of all, the long-term patient and those supporting the long-term patient?
Absolutely. When an individual comes to our building, we discuss finances, and that's very hard to do because typically you're dealing with people who are in an emotional situation. And when you make financial decisions, you don't want to be emotional. You just want to be black and white. And so we sit down, we try to walk them through the process. Yes, you have this money saved right now. This is how much it is to stay at this facility. This is what's covered. This is what you're going to have to pay for extra outside of these other items. And if you apply for Medicaid, we kind of help walk you through that process. We can't do it for you.
Right.
Because we can't get access to your bank records and submit those. So we walk you through that, but we try to take you by the hand and help you along the way so that you make educated decisions.
You know, we were talking about you being certified in Medicare and Medicaid, especially Medicaid. You're certified in 2 states.
That's correct. We are Medicaid certified in Tennessee and also North Carolina.
You also, for folks that are coming in here to Erwin Health Care Center for the very first time, you offer tours. And
Absolutely.
you want to encourage folks to come and check out the facility.
Oh, absolutely. We're doing a lot of interesting things here at Erwin Healthcare. Like the room we're sitting in, this is one of the resident rooms that we have available. Private room. Our residents enjoy free Wi-Fi, free cable. Life doesn't end when you enter a nursing home. A nursing home is not a warehouse for people to go and sit and wait for the end to come. It's just a safe environment for those people to live as independently and as fully as they can.
A lot of facilities, long-term care, short-term care facilities don't allow any smoking, but you have designated areas for those patients that do come here that continue to smoke.
That's true. This is their home, just like the house that they used to live in. We do have designated smoking areas, designated smoking times, and that is something we have gotten several residents who have come here.
Jason Bennett, we appreciate the conversation. A great conversation about
much.
Erwin Health Care Center. Folks, if you want to find out more about the care that they provide here and the financial side of things, we got all of that information for you right there on the screen. The preceding segment sponsored by Erwin Health Care Center.